hand hygiene. Hi, my name is Gabriella. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay, perfect. So the physician has ordered that we put indwelling Foley catheter because you have chronic retention of your urine. Is it okay if we do this? Okay, perfect. So I'm just going to check on the computer if you have any known allergies. It says you don't have any allergies. Do you have any allergies to latex or anything, just to clarify? Okay, perfect. So I'm going to need you to sign this pelvic exam consent form. This is required by the state. It's just so we can move on with this procedure and that you're allowing us to do this. Okay, perfect. So I'm going to be right back. I'm going to get all the stuff for the kit, or I'm going to get the kit, and I'll be back. So I'm going to do hand hygiene when I leave, do when I come back, and now I have my kit. I'm going to make sure that it's not expired, which it isn't. It's a 14 French catheter, which is authorized for this patient, and it is intact. Okay, I'm going to do hand hygiene, put on clean gloves. Okay. So I'm just going to move down these sheets. Okay, if you could get in the dorsal recumbent position. Okay, here's the meatus. I'm going to palpate the bladder, which does feel distended. Okay, she doesn't need perineal care. Usually once the catheter is in, we would do perineal care with the catheter care every 8 hours. Okay, now I'm going to take off these gloves, perform hand hygiene again, and begin the procedure. Shiny side down. Okay. Okay. So I'm going to go ahead and open my swabs. And I'm going to take them all out, place them in there, pour the liquid. Okay. Trash. And open my lube. Go ahead and take off the cap to this 10 milliliter syringe that's going to attach to here, this is what we were going to use to inflate the balloon, and there's saline in here. Let me go ahead and unwrap catheter. I'm going to go ahead and put glue in here. Now that that's all ready and prepared, I'm going to go ahead and commit my non-dominant hand. I'm going to start with the far side. Outer side. Down the middle. Okay. Now I'm going to grab catheter, hold it about 2 inches away. I'm going to begin to insert until I see urine. And I see urine. So now I'm going to insert it about 1 inch or 2 more. Okay. Now I'm going to commit. Go ahead and push the 10 milliliters. Okay. Go ahead and take it out. I'm going to seat it. Seated. And now I will attach the tubing to the inner thigh. I'm going to go ahead and take off my sterile gloves. And I will attach the bag to below the bladder on the side of the bed. And then I will note how many milliliters and if there's any odor, the color of the urine, and then I'm gonna document that, and then I'm also going to document the date, the time, the size of the catheter, and how the patient tolerated the procedure. And how I would know if the balloon is inflated in the urethra is if the person experiences a lot of pain while I was pushing the 10 milliliters, which they didn't, so we know that it is inside of the bladder and it is seated. And that's it.